Hey, LinkedIn, and welcome back to Business Unusual. This is a live show where we're talking as a community about the changing nature of work. I'm Caroline Fairchild, editor-at-large here at LinkedIn News. New York City, the epicenter of the coronavirus and where I'm coming to you live right now, appears to be flattening the curve with a significant decrease in cases. And on Monday, Governor Andrew Cuomo began phase one of reopening the city. And while New York, the largest city in the country, appears to be making progress, 19 states across the country are seeing an increase in cases, and 7 states are holding steady with their numbers. Health experts have warned for some time for a second peak into the COVID-19 cases, and it appears that we are on the precipice of just that in many places across the country. On today's show, we'll speak with an executive from the largest healthcare company in the nation, CVS Health, to get her take on how she's preparing both customers as well as employees for this second spike. Executive Vice President of CVS Health, Lynch, will be joining us on the show. And she's been leading on this front for quite some time, as well as advising both customers and employees on how to prioritize their mental health during this crisis. 2/3 of adults report more stress now compared to this time last year, and more than half of adults surveyed would find mental health care services useful to their household. Karen will talk about how CVS is addressing that, not just in the wake of a pandemic, but against the backdrop of national protests over police killings of Black Americans. But before we bring on Karen, we want to hear from you. The whole point of this show is to have a conversation as a community about how the changing nature of work is being impacted by not just this pandemic, but protests and a lot of activity outside of our home offices, and for essential workers having to commute into the office right now is extremely challenging. Let us know how your comments and questions in the stream. If you have some insights that you'd like to share, we'd love to hear them. And of course, if you have questions for Karen, our mental health expert, please let us know in the stream as well, and we'll get to your questions on today's show. And with that, I'd like to bring on Karen to the stream.
Hi, Caroline.
Thank you so much for joining us.
Thank you for having me. It's a pleasure to be with you today.
So pre-show, we were talking about this. In New York City, we're seeing a flattening of the curve, but that's not the case across the country. I'd love to get a bit under the hood with you in terms of how CVS is thinking about preparing customers right now, who in many cases may feel like we've beyond the brunt of the pandemic.
Well, Caroline, you're right. We're not beyond the brunt of the pandemic. It is here with us, and I believe it is here to stay. And there's been a number of conversations and discussions around a second wave, but I think we all have to recognize that the virus is here. And as we were talking earlier, we all need to be incredibly vigilant about, keeping our social distancing, keeping our masks on, and making sure that we continue to wash our hands, because the virus is ever present. CVS, we have been working really hard over the last couple months to bring testing capacity to the U.S. So we started with building out tents in large scale tents in a number of different states so that people had access to tests. And now we are working with large employers and employers across the U.S. To prepare to bring their employees back to work. And we're doing that by giving them the opportunity to have point of care testing at their sites or in CVS locations. We just brought up 1,000 of our CVS stores where we have the ability to access more tests, and we're doing a swab and send, meaning that you do a nasal swab and we send it out, and then we bring it within 3 to 5 days. You'll know if you have the virus. And then we built a comprehensive return to work program for employers to bring their employees back, which includes thermal scans, so checking temperature, includes reporting capabilities so that we could actually see through our testing if they'll have specific hotspots in some of their locations. And we're also doing contact tracing as well, so that when an employee does have a positive test, we know who and where they were, so that we'll be able to help the employer with that contact tracing to let everyone else know, so that they can either get a test or quarantine. So lots of activity. Clearly testing is critically important, for this virus, and understanding who has it and who doesn't.
You mentioned employers who are now just rethinking about reopening their offices and what that will look like to make sure that employees are safe. But of course, CVS as an essential service has had to keep their retail stores open through this pandemic. I'd love to hear what you're hearing from employees who are having sometimes to choose between a paycheck and feeling safe going to work. How are you ensuring that they are making the decisions that are right for them and their family during this challenging time?
It's a great question, Caroline, and we are an essential company, and our employees have actually told us they feel like they're an army on the front line trying to protect the nation from this virus. And we have been very clear about telling employees if they are sick, not to come to work. When they do come to our stores, we are temperature checking. We are asking all of our employees to wear face masks. We're asking people who come into our stores to wear face masks as well. We have set up the shields, all the protective shields in all of our stores, because when we started going through this pandemic, Caroline, we were very clear that we had 4 key principles of managing the company through this pandemic. And one of the most important principle was keeping our colleagues safe and healthy. And we were very aggressive in trying to make sure that our employees were healthy and safe, and did everything we could and continue to do so to keep them safe. And we're thinking about when we bring our employees back to work, but 90% of our employees were in the store locations, and we couldn't be more thankful for the work that they did and being there for the rest of America, so the rest of America could have access to their prescriptions and to other needs that they needed in our CVS stores.
And for those of you who are just joining the stream, this is Business Unusual, a live show where we're talking about the changing nature of work. I'm here with Karen Lynch from CVS Health. We're having a conversation about how she's thinking about keeping employees and customers safe during this challenging time. I want to say hi to Paul from California, Joni from Canada, Clint from Massachusetts, Stephen from Florida, and Stacy from Texas. Thank you so much for joining us. Karen, we were just talking about how CVS is an essential service, but what else is CVS is one of the few employers right now that has been able to hire through this pandemic. We have a lot of job seekers on the platform right now. What roles are open right now, and where are you hiring in terms of the opportunities for those who have been furloughed or have lost their jobs in other sectors?
Yeah, so we've been hiring a lot of individuals in our stores, so across the board, across the country, mostly for our front store sales, some pharmacy techs. So we had a hiring goal of 50,000 employees, and we continue to be hiring in those retail locations. And we've been working very closely, and I think that this was something that was really unique, and we were very excited that we were able to do this. We worked with some of the companies that were furloughing, like a Marriott and a Hilton, and we had a very strong partnership with them. When they were furloughing their employees, they were sending them to us so that we could hire them, so that we had that joint partnership, and it worked really well. And we know that when the Marriott or the Hilton wants to bring back their employees, that they'll go back from the CVS stores if they want, and then obviously we'll be hiring to replace those individuals. So what I would recommend is that you go on to cvs.com there and fill out an application, and certainly we're in that process of continuing our hiring.
That's great. And Karen, we were talking about before the show that this topic of the pandemic and also the protests has really had a drain, not just on people who have lost their jobs, but everyone in terms of their mental health. And this is a topic that you've been leading on for quite some time. When did you know, I take me back to the beginning of this pandemic, that we were going to have to go through this mental health crisis in this country through this?
Caroline, I think, very shortly after, when everyone was in lockdown and isolation, we realized the level of stress, the level of anxiety. We started to see the enormous amount of layoffs. And it was clear to us, and just watching our own employees, it was, and even personally, obviously, there's a lot of stress when you're used to doing things one way and you have to switch on a dime, that we knew that there would be a second, well, I call it the second wave, or, as we've also referred to it as the undertow, because a lot of times, when you're at the ocean, the waves are crashing on, and you don't see that strong undertow that's occurring. And that's what we believe is happening with mental health, the loss of job, the social isolation that people have experienced, the anxiety, the stress, moms that are, trying to educate their kids at home. That's been an incredible stress. So, we knew that this would occur, and, we've been in the forefront of driving mental health access and resources. Quite frankly, my hope is that, this pandemic will help us eradicate the stigma of mental health, because we are seeing now, more often than not, more and more people talking about mental health. And, I've been spending a lot of time with CEOs across the country, and this topic wasn't on the agenda. It wasn't in the boardroom. It wasn't anything that they were considering, and it clearly is now. And it's made it easier, for us to provide resources and access to, our customers as well as our own employees. I don't think, Caroline, that there is a communication or a conversation that we're having that we don't talk about access to our resources for living, which is also our EAP program internally. And I can tell you that during this pandemic, we had a number of our customers reach out to us for crisis management. We put crisis management counselors in distribution centers of some of our largest customers. We've gotten accolades from the CEOs of those companies about the access and thanking us for all the things that we're doing. I can't emphasize enough the critical importance of having this conversation and making it easy and comfortable for people to access healthcare, mental health care. It's critically important. And Caroline, I'd also tell you, you can't separate mental health from physical health. The two go hand in hand. And I think for a long period of time, we have as a nation separated mental health from the physical health. And I always say your head is attached to your body, and you need to take care of your body and your head. And you need to have, make sure that you're paying attention to both.
Well, I'm definitely seeing some members in the stream right now agreeing with you, Karen. David says isolation is a problem. Fear of job loss, stress from job loss, and inability to do one's regular work in the usual ways are all problems. Sarah says empathy is going to be the biggest asset to have returning to work during this pandemic. David and Sarah, thank you for joining us on the show. Karen, you mentioned how challenging this topic is to have with employees. It's ridden with stigma right now. It's not something that even, I would say, in January, a lot of CEOs were thinking about, and now that's been flipped on its head. For the executives and for the managers who are on the stream right now, what do these conversations actually look like for those who are afraid to even attempt to have that one-on-one with the direct report who seems to be challenged on the Zoom call? Where do you start?
I think you start by asking the question, how are you? And you ask the question, how are you really? And because how are you comes across as sort of a throwaway. But how are you really shows that you really care. And I think that's the first conversation. And then I think you'll be surprised at how quickly people open up. And I think part of it is showing some vulnerability in yourself and some of the challenges that you may be facing. I know personally, as I've been doing town halls with all of our employees, I've been sharing with them some of the trials and tribulations of that I've been dealing with throughout this pandemic. And even it could be the stupidest things of, burning a pot with boiling potatoes and, because I was distracted and stressed out about something that was going on. It invites the dialogue and it invites the conversation. And I think once people feel comfortable inviting that conversation, you get a good sense of having how they are and where they are. And then it gives you the opportunity to potentially refer them to an EAP resource, or to, if you feel like they're in crisis, to crisis text online, or any of the other available online resources. So I think that's where you start. I think you start with how are you really? And I think you start with your own vulnerability, because every single one of us, I don't care who you are, has experienced some stress, some anxiety throughout this entire pandemic that we've been going through.
I don't think a truer statement has ever been said on Business Unusual. So thank you for that. And of course, CVS has access to a ton of data to tell us from what customers are buying right now in terms of perhaps where we are with this mental health crisis. What are you seeing? Is it getting better? Is it getting worse? Things like alcohol sales, where are those right now in terms of where we were at the beginning of the pandemic and where we are now?
Yeah, so we've seen a number of statistics. Unfortunately, we've seen a 30% increase in alcohol sales. We've seen an increase in drug prescriptions for antidepressants. We've seen an increase in the number of calls coming into our own Resource for Living, or EAP lines. And we opened up our entire EAP Resource for Living lines for the country. And when this pandemic started, we also, it supported our frontline workers who are seeing unimaginable things in the hospitals. We opened those up, so we have some really good insights, and so we're seeing mental health on the rise, which is part of what I anticipated and would have expected. Which is all the more reason why, as leaders, as managers, we need to have those conversations to make sure that people are getting the help. Because the other thing that we've seen, Caroline, is an increase in domestic violence, and a lot of that came on early, and continues to be a challenge as well. And so, again, you never know what's going on behind the behind the scenes for people. And that's why I think the conversation, not only at work, but with your friends, with your family, I think it's really critically important to, open up the conversations and be interested, and then find those resources. And like I said, we've opened up all of our EAP lines across the country. So we're making access available for people.
And the whole point of the show is to have that conversation. And I'm seeing some members from the community appreciative for you taking some time to speak with us. Cassandra says, thank you for taking the time to talk about this. It's comforting to know that I'm not alone with how I'm feeling when it comes to all this uncertainty. Jacqueline says, I like the how are you really? Never thought of that. So thank you for that. And if you're just joining the stream, this is Business Unusual. We're talking about the changing nature of work with Karen Lynch from CVS Health. She's giving us some insights into how to maintain some semblance of mental health during this crisis. And Karen, we've been talking a lot about the coronavirus and this pandemic, but we can't ignore the fact that there are national protests going on across the country right now for police killings of Black Americans. CVS stores have been impacted by this. How are you speaking to employees about that on top of everything else going on?
Yeah, so it's interesting. We've first of all, there is unrest, and I do believe that it was a senseless murder of George Floyd, and clearly as a nation, we really do need to have that conversation about racial injustice and take action and make meaningful change. We're talking to our stores have been impacted. And as you might imagine, some of our stores were in the heart of some of the protests and some of the riots. Some of our stores were, put on fire. We have smoke damage. We have water damage. And as I said at the top of the show, our employees feel like they're an army on the front lines, supporting the pandemic and supporting America. And, they're hurt, and they're scared, and they have anxiety. And as you would imagine, if you had that going on around you, you would too. And so we've been putting crisis management counselors in our stores. Obviously we have access to our phone lines. We have the crisis text line where we have a partnership with. So we've been doing a lot to have those conversations. We have a resilient employee core, and they're back at it. We were able to, there was hundreds of stores that were impacted. We were able to open up 90% of those stores within 48 hours. But there are a number of stores that have such significant damage that we have to rebuild. And we're working very closely with those employees to relocate them to other stores. Unfortunately for us, we have a CVS store almost on every corner, so we have the ability to be flexible with our employee population.
And in terms of those conversations that you're having with employees about the protests, what are they telling you? It's something that every employer is having to commit to right now, having these difficult, uncomfortable conversations around racism in America. Anything from the town halls that you've had that you think the members on the stream could benefit from hearing?
Yeah, I sent out a note early on when this all occurred, and I'll tell you, I learned a lot. I received a lot of emails from our own employees. I've had a number of one-on-one conversations, and the stories that they share and the fear that they live in, I never knew. So part of what I would tell you as leaders and managers is, again, it goes back to you really need to seek to understand. You need to listen. You need to understand that, if you're like me and look like me, we don't know. And you need to recognize the vulnerability in ourselves that we sometimes we have different experiences than some of our colleagues. And that's an important dialogue to have. And then I think, and then we need to look at our businesses and make sure that we are doing the right things for our business. Are we giving our colleagues the right development opportunities? Are we making sure that the compensation practices are appropriate? Are we doing things in the community to support the vulnerable populations? So I would say, again, it's listen, it's learn and not judge, and then really reflect on the experiences that our colleagues are having or have had throughout their lives, and then make a commitment for change.
Mm. Lionel here has a comment about our conversation saying, inspiring and motivating leadership that makes people feel that they're engaged in a larger struggle has made a difference. The countries with such leadership have done the best at controlling the outbreak and preserving mental health. I want to get to some questions from the stream as well, Karen. One from Helen, who wants to know, how do we accelerate parity of care of all health, especially physical and mental health? How can we ensure fair access regardless of employment status?
Yeah, so, clearly mental health parity has been a topic of conversation. We have mental health parity laws. The challenge that we have is access. Over 60% of psychiatrists that are 55 years or older. So access is clearly an issue when it comes to parity of mental health. And it's important for us to make it an important profession and make it so that people are interested in going into psychology, going into psychiatry. And I think you get access parity there by opening up the access to care through having the right providers. Fortunately, digital technology, telemedicine, telepsychiatry is helping with that access. But clearly, we need to support the profession, and we need to make it a profession where people are interested in and going into, because the demographics of the population as we see them emerge, the demand for mental health services is increasing every day. And we need to, as a nation and as a country, make sure that we have the supply to support that demand.
Mm. And we spoke earlier in the show about some advice for managers who perhaps need to broach a conversation about mental health with their employees. But I see a question on the screen from Devin who says, how do you communicate your mental health concerns with your manager? So if the conversation is going the other way, what are some best practices?
So, I think that it's important, as I said, to share sort of your perspective, your vulnerability, what's going on. Early on, personally, I lost my mom to suicide when I was 12. And I remember the first day I shared that. And I will tell you, Caroline, I didn't share that for many, many years. I was embarrassed. I was scared. I thought people would judge me. The minute I shared that story with our employees, it immediately opened up the conversation more broadly. And I would, as leaders, I think it's, important for us to share those things, that it's not a horrible thing. And then I would tell you, I think you recommend to people different things that they could do. I mean, continuing to exercise, continue to practice mindfulness, doing things to support your community. I think I shared on LinkedIn not that long ago, kind of the 8 steps to, think about things to do during the pandemic to keep, kind of keep your mental health and keep some sanity. And I would encourage you to have those conversations as well.
I've seen a comment here from Brad who says, I think some folks have been dealing with anxiety for years and COVID has given them time to self-reflect. This is where we realize we have neglected our mental health. We must be our own largest advocate. Which gets to a question that I have for you. Are there any positive trends in terms of how we're speaking, dealing with mental health right now that you hope will persist beyond this pandemic that will have a better impact, not just on workplaces, but just on our collective community?
Yeah, Caroline, I think the fact that you're having this kind of conversation around mental health, the fact that boards are talking about it, the fact that I can't tell you how many, people, consulting firms and other kinds of companies are bringing it to the forefront, to have these dialogues and conversations. We're really opening up the conversation, but it's up to every single one of us to continue the dialogue and to, push for the conversation to happen, to push for mental health parity, to push for access, and make sure that when we have those conversations where we're helping people think about the resources and know where those resources are and know the availability of those resources.
Well, Karen, thank you so much for not just opening up your home to us for this conversation, but also opening up about your personal story. I know I speak for the stream when I say thank you for your leadership during this time and joining us on Business Unusual.
Thank you, Caroline.
That was Karen Lynch. She's an EVP at CVS Health, as well as the president of Aetna, talking us through a path forward for mental health coming out of this pandemic and protests around the country against police killings of Black Americans. I want to thank her for coming on today's show. This is Business Unusual, a live show where we're talking as a community about the changing nature of work. We come to you live every weekday, 12 Eastern, from the LinkedIn news page. Tomorrow, my co-host, Susie Jackson, will be speaking with Whitney Johnson about how to disrupt your career during this challenging time. Perhaps you are going through a career pivot right now. Be sure to tune into the LinkedIn news page at 12 Eastern tomorrow to catch that conversation. I'm Caroline Fairchild. Thank you so much for joining us.